Hi, good day guys, I am Abraham. I'll just take you through the upper limb anatomy, just simplified with a lot of cartoons. So like with any part of the body, upper limb, the concept is you've got the bony structure, you've got the covering muscles, then you have got the artery that feeds the muscle and the nerve that helps the muscle to move. So you just need to know the blood supply, the nerve supply, the origin and insertion of these muscles. So broadly classifying it, you've got the joints and you've got the bone. So the joint you start off with is the axilla, and then you've got the arm, and you've got the elbow joint, then you've got the forearm, then you've got the wrist joint, and then the hand. So talking about the muscles around the shoulder joint, so it can be broadly classified into three groups. The first one are the muscles that attach the upper limb to the vertebral column. The second lot are the muscles that attach the upper limb to the scapula, and the third lot is the muscles that attach the upper limb to the chest wall. So under these muscles that attach the upper limb to the vertebral column, you've got trapezius, latissimus dorsi, levator scapula, rhomboids major and minor. The muscles that attach the upper limb to the scapula, you've got the deltoid, you've got the supraspinatus and the infraspinatus, teres major, teres minor, and subscapularis. You need to know about the four rotator cuff muscles, which are the supraspinatus, the infraspinatus, teres minor, and the subscapularis. The muscles that attach the upper limb to the chest wall are the pectoralis major, the minor one, subclavius, and the serratus anterior. So talking about the bones of the upper limb, so you've got the shoulder joint, which made up, you've got the clavicle, the scapula, the humerus, and when you come down the forearm, you've got the radius and the ulna. Then you've got the carpal or the wrist bones. Then you've got the metacarpal and the phalanx. So these muscles of the upper limb, we can divide it into different compartments. So if you take the arm is divided into anterior and the posterior compartment, and in the anterior compartment of the arm, you've got the biceps, which has got a long and a short head. You've got the coracobrachialis, the third one is the brachialis, and in the posterior compartment you've got the triceps, which has got three heads, with the long, lateral, and the medial head. So when you come down to the forearm, you've got three compartments. It's easy to remember. Along with these anterior and the posterior compartment, you've got a lateral compartment as well. So in the anterior compartment, you've got all the flexor muscles. In the posterior compartments, you've got the extensor muscles, and in the lateral compartment, you've got two lot of muscles, that's the brachioradialis and the extensor carpi longus muscle. So coming to the hand, you've got the short muscles of the thumb, the small muscles of the hand, and the short muscles of the little finger. So talking about the blood supply of the upper limb, it's a fairly easy schematic diagram to remember that. Talking about the veins, you've got the axillary vein, which branches into cephalic and basilic vein, and you've got the important structure in the cubital fossa, that's a median cubital vein joining both these veins. And talking about the arterial supply, you've got the axillary artery coming down as a brachial artery, and when it gets to the forearm, that is in the cubital fossa, this brachial artery divides into radial and ulnar artery, and when it comes down to the hand, the ulnar artery forms a superficial and the deep palmar arch. So this is an important concept. Ulnar is always closer to your body. That part, when you describe an ulnar side, it means it's closer to your body. Easy to remember, it's just remember you with me. So talking about the three important nerves in the upper limb, one is the median nerve, which supplies all the forearm muscles. Second one is the radial nerve that supplies the arm muscles and the forearm extensors. Third one is the ulnar nerve. It's a very important nerve that supplies the intrinsic muscles of the hand. So these are three important upper limb nerves you need to know. So with these nerves, the important thing you need to know is the muscle supply as well as the skin supply of these nerves. So the ulnar nerve, if you have a damage, you get the ulnar nerve palsy, which is the ulnar claw hand. If you have a radial nerve damage, all the forearm extensors are pretty much done. So you will have a wrist drop. So that is when you lose the action of the extensor muscles. So when you have a median nerve damage, you know the thenar eminence muscles are lost and you get a ape-like thumb. Talking about the ulnar nerve, it doesn't have any supply to any muscles in the arm. When it comes down to forearm, it supplies only two muscles. One is the flexor carpi ulnaris. The second one is the flexor digitorum profundus, just the medial half. So when you come down to the hand, a lot of muscles in the hand is supplied by the ulnar nerve. So these are the four broader lots of the muscles. First one is the digiti minimi ones. They are the abductor, flexor and opponents. Second one is the interossei, all the interossei muscles. Third one is the third and fourth lumbricals, and fourth one is adductor pollicis muscle. So the ulnar nerve supplies the hypothenar eminence. So concept wise, the median nerve supplies the thenar eminence muscles. So the three thenar eminence muscles and the first two lumbricals are supplied by the median nerve, and the ulnar nerve supplies all the muscles of the hand, including the muscles of the hypothenar eminence, third and fourth lumbricals and the interossei muscle. So talking about the brachial plexus, as you know, it's composed of roots, trunk, divisions and cord. It can be seen as it can be compared to a tree. Just like the roots of a tree, you get the C5 and C6, they combine together, and these roots, they form the join and form the trunk, and from the trunk it divides into two. They form the divisions, and these divisions they join and form the cords, and cords further form the branches. So the important nerves you need to know are the ulnar nerve, the median nerve, the musculocutaneous nerve, the axillary and the radial nerve. So it's another easy way to remember the important structures of the brachial plexus, thanks to Susan Blake. So it's the first one. You can see a guy standing there. So C5 and C6, they form the eye. The roots, they form the eye of this man. So he's on the dance floor, ready to have some fun. So he's soon joined by C7. That's a pretty looking young girl. You can see he's holding on to her and having a nice dance. And then suddenly this lovely couple, they are interrupted by the C8T1 guy. So he's very keen to get this girl to dance with him. So you can see he's also trying to hold her by the back and trying to get involved in the dance. So then C5 C6 gets upset and he kicks the C8T1 guy. Then what happens is that the C5 C6 guy says, "Are you stealing my girl? See my muscle." So you can see from the cord you get the muscle or the musculocutaneous nerve, and take the kick. You can see the cords of C5 C6 and C8T1, they join together and they form the median nerve. That's the kick. Then the C7 girl says, "Oh, take an X-ray." So X-ray means X is for axillary nerve. That's one of the branches coming out from the C7, and ray is the radial nerve. You can see it here. And this guy says, "You broke my foot. You will," which means ulna, "you will be sorry." So it's a easy or quite a good cartoon to remember. So you can see from the C5 C6 root you get the musculocutaneous nerve, and C7 you get the axillary and the radial nerve, and the all these, the guys at the extremes, they form the median nerve, and CA-T1 guy gives out the ulnar nerve. So it's a CA-T1. You've got the roots, you've got the trunk, you've got the divisions, you've got the cords and the branches. Alright, coming to the median nerve, it doesn't have any supply in the arm, and it has an important branch, that's the anterior introsus branch. So the median nerve is the king of the forearm flexus and savior of the thumb. So it starts from the medial and lateral cord of brachial plexus. It originates in the axilla, and it's got a very interesting relation to the brachial artery, which I'll come to you shortly. And you can see that it jumps from the lateral side to the medial side in the middle of the arm, and at the level of the elbow it leaves the at the level of the cubital fossa, it leaves the cubital fossa between the two heads of the pronator teres. In the arm, it's sandwiched between the flexor digitorum profundus and flexor digitorum superficialis muscle. At the level of the wrist, there is a very important relation. It enters the wrist by passing between the behind the flexor retinaculum. You know, the ulnar nerve passes in front of the flexor retinaculum. This is an interesting cartoon to learn the relation, the tract of median nerve in the arm. So you can see there are it's a 3-lane road, and you can see the median nerve car overtaking the brachial artery. So he gets out of the lateral lane, drives past the brachial artery and gets into the medial lane, and this happens in the arm. It happens in the middle of the arm. So I've just named his arm race. So in the cubital fossa, the median nerve makes a special appearance. It leaves the cubital fossa by passing between the two heads of the pronator teres. You can see the happy and the sad head of the pronator teres in the cubital fossa, and median nerve leaves in between these two heads in the cubital fossa. Another important thing about the median nerve is that after it leaves the cubital fossa, you can see that this guy holding the anterior introsci, it gives out the anterior introsci branch, and this guy is saying, when I am leaving the cubital fossa, I will give you the anterior introsci nerve to supply the forearm plexus. So this nerve supplies all the forearm plexus, and when the median nerve comes to the wrist, it goes through the carpal tunnel. So it's a very important relation you need to know about the median nerve in cubital fossa. In the wrist, it goes through the carpal tunnel, not outside the carpal tunnel, because of which you can get compressed and you get the carpal tunnel syndrome. So you can see in this cartoon that this guy is driving through the tunnel to get to his favorite thumb. So it's, you know, the thenar eminence and the thumb is supplied by the median nerve. So beyond this wrist, you can see the median nerve branches like a flower. So it branches out like a flower and goes when it goes past the wrist to supply the muscles of the thenar eminence. So the next is the radian nerve. The radian nerve is the king of the arm and savior of the